Shot. And good afternoon. I'm Dr. Deuk. Our patient has chronic lower back pain coming from her buttocks. Did you inject? On both sides. We diagnosed her using what's called the Deuk spine exam. She has shot bilateral piriformis muscle tear. What is that? Well, there's a muscle deep in the buttock that normally is painless, but in some patients, it becomes torn and very painful. In her case, she has muscle tears in both buttocks. Shot? I'm sorry? Shot? It's under my foot? Sorry. Henry, while we're preparing the patient to get started,
Yes.
can you please show the audience hold on a second. Can you connect the Bovie, please? Tell me when you started the video, hon.
Copy that.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our video that the piriformis muscle, once it's torn, the body tries to heal it through a process called inflammation. Inflammation is where your body uses the inflammatory system to try to repair things such as damaged tissues, like in this case a muscle. And right now what I'm doing is I'm trying to get down to where the muscle is attached to the hip. The muscle itself is called the piriformis muscle, and you can see the tip of my probe, Jordan. That's exactly where it attaches. And the piriformis release is where I release the muscle attachment off of the top of the hip by basically cutting the scarred up fibers that are causing all the pain. So I like to start right on the greater trochanter with the tip of my probe. I like to feel the bone right there, and then I have my starting point. And from there I work my way up and down, releasing the muscle fibers. Any questions?
At this moment, no current questions.
When I'm done releasing, I like to come back to the same spot, which is the greater trochanter, and start out on my next release of fibers. We can hear the fibers being released. I can feel them. You feel it too, right? All right, any questions on piriformis muscle release? This again is the third most common cause of back pain.
No current questions, but we do have a comment coming from B Bala on YouTube.
All right.
Their name is Dawn, saying, "Good afternoon, sir. I am looking forward to seeing you soon. I am going to get my MRI done at your facility and also get your expert evaluation while I am there, coming from Miami Beach."
I look forward to helping you. We will make a diagnosis as long as you have the pain. It's very important when you come to us that you do not take painkillers that morning, that I can see where your pain is coming from. I want you to have the pain so that I can identify the source and make a diagnosis. People believe that back pain is something that you can diagnose from an MRI, but you cannot. An MRI or X-ray or CAT scan, even a nerve test, none of those tests tell us where pain comes from. I've been doing this for 29 years, and Deuk Spine is the top center in the world for diagnosing the cause of back pain. And I can tell you, I diagnose it on the physical examination. Very important. We finished the left piriformis release. Now we're going to go to the right side. We're going to put a little bit of numbing medicine, and we're going to make an incision. I'm going to bring my probe down to the right greater trochanter. We're going to release the piriformis muscle on the right side next. Any questions from the audience?
Yes, we have a question coming from Frank on YouTube,
Welcome back, Frank.
asking, is there any downside to cutting this muscle and releasing it? Does it affect walking or anything like that?
Great question, Frank. So the muscle itself is an external rotator of the hip, but it's a useless muscle. It's absolutely unnecessary. It does nothing good for you. All it does is get injured and cause horrible pain in the buttock, top of the buttock. Okay? It's an incredibly common problem. And when we release it, the pain goes away immediately in the buttock, like immediately. But obviously it's replaced by a new pain, which is the pain from the surgery. So you've got to get the procedure done and then be patient and let it heal. And it will heal, but it can take time to heal. All right, so the answer to your question is no. The muscle is useless. You'll never know that it's not there anymore, except that the pain you had in your buttock will be gone, and you'll be very thankful for that. Sorry, she's very deep, so I'm trying to get to the right spot. For me, if you're a surgeon that you want to copy my technique, I always dock right on the back of the greater trochanter. That's not the right spot. It's a little higher. And the trochanter is very, very slippery. I mean, super slippery. So when you put your probe there, it could slip. All right, so I'm a little bit too lateral. I want to be a little bit more medial, but this is the right area. Our patient has suffered with buttock pain, lower back pain for some time. She's now here to get this release done, and the pain that she had coming here will be gone. It will be replaced by a new pain, which is the pain from my procedure, which goes away, usually within a few days. Sean? So far, her surgery is going very well. We're done. We'll be done in a minute. Any other questions?
No current questions, so we do have a comment coming from B Bala once more on YouTube, saying, I do have piriformis pain for a fact, and I've been dealing
Sean?
with this for years. And okay, great. Good to know. Thank you, Dr. Deuk.
Yeah, you're welcome. So we have treated piriformis pain for about 20 years here at Deuk Spine, and what we found is that, all the treatments we've done, all these shots, Botox, PRP, stem cells, steroids, doesn't matter. All those treatments, they stop working. Literally, you do the shot, you do the treatment, the patient comes back usually within a few weeks or a few months, and the pain is back. So this is the only treatment that we found that's permanent. All right, I think we're done. This has been a particularly difficult case because the depth of the piriformis muscle here. But I'm 99% sure we got it all, and I feel pretty good about it. All right, guys, that's it. Great job. Thanks for joining us, and we'll show you one more time the video on how the piriformis causes pain and how we treat it surgically. Okay? Thanks for joining us. We'll be back shortly with one more surgery today.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800